Welcome to the Red Chair series. This is a groundbreaking initiative brought to you by the American Heart Association Philadelphia and proudly sponsored by Mainline Health. The goal here is to shine a light on women's heart issues. And the topic at heart today is atrial fibrillation. It is a common but manageable heart rhythm disorder, but it does carry a higher risk of stroke. We're gonna dive into that with Dr. Maribel Hernández, who's joining us for this episode. She is a cardiac electrophysiologist. It's a big fancy word, but basically it means that you manage patients with heart rhythm disorders. She's also an advocate for earlier detection, more women-centered research to help improve outcomes, and she's the medical director of the Women's Heart Initiative. Good to have you here.
Thank you for inviting me.
Thank you. So can we start with sort of the elephant in the room? Atrial fibrillation. We hear a lot. It's often called AFib, but what is that? What does it mean in layman's terms?
It is an irregular, chaotic rhythm which originates in the top chambers of the heart, called atrium. So what happens is that when the top chambers become beat in a disorganized, chaotic way rather than in the organized way that it should be, blood can pool in the top chambers, specifically in the left side, in the left atrium, and very tiny clots may form. Then these tiny clots can travel up the heart, all the way up the aorta to the arteries in the brain. That's when you get a stroke.
How would I know if I have AFib? It sounds like something that I may not necessarily feel. It seems like it's a tiny electrical thing, but it can have big impacts. So how do I know if I have it?
When it comes to symptoms, there's a wide spectrum. We have patients that have the irregular rhythm and they have no idea they have the arrhythmia, and it's only detected when they go to the regular checkup and the physician gets an electrocardiogram or listens to the irregular rhythm. The more common symptoms, which are palpitations, sometimes it's trouble breathing, decreased exercise intolerance, fatigue. And then we have patients at the other end of the spectrum that present with severe symptoms, shortness of breath. Since the heart is not pumping properly, they develop heart failure.
So if I feel like I have some of these symptoms, what's your best advice? Should I go see my doctor right away?
You should see your doctor right away, even if the fast rhythm stops. Because we know that once you have a problem with the electrical fibers, this rhythm tends to come back and you need to be evaluated.
So with the help of the Go Red for Women movement, we're learning more about the evolving needs of women and clinical care gaps. So when we talk about women as a whole, are there any differences that we see in women based on ethnicity perhaps?
Black women have a much higher prevalence of stroke than other women. And one of the reasons is that it is estimated that Black women 20 years old or older have a 58% incidence of hypertension. Black women also have other risks such as obesity and diabetes that predisposes them to development of heart disease, hypertension, and atrial fibrillation.
So now I want to ask you about what happens if I'm diagnosed with AFib. What can I expect after I get that diagnosis?
The good news is that we have many treatment options, but the treatment needs to be individualized. As we mentioned earlier, some people have very few symptoms and other people have severe symptoms. Some of the treatments are medications, and within that group of medications, one of the most important goals is to prevent clots. We want to prevent stroke.
So what is life with AFib like? Can I continue once I get this diagnosis doing the things that I love, my day-to-day activities, or would life change dramatically?
Our goal is that our patients have a completely normal life. But to get there, you need to work closely with your physician, usually a cardiologist, and your healthcare team to help you manage and treat the condition properly. I encourage women to be their own advocates, and if you're prescribed a medication for atrial fibrillation but it's not working, don't wait 6 months or 3 months for the next appointment. Immediately communicate with your doctor, communicate with your team, because we usually find the right combination of medications or treatment so people can have an active, productive life.
All right. Dr. Hernandez, thank you so much for joining us for this episode of the Red Chair series, and make sure you stay tuned for the next episode.
Thank you.